CHATIME viewers, I'm Kumar, your host for ChaHealth. And today with me, I've got Kerry from Sport Auckland talking to us about green prescription. So let's find out what green prescription is all about. Hi Kerry, so what is a green prescription, Kerry?
So a green prescription is a referral from a GP or a practice nurse recommending their patient become more physically active to benefit their health.
Right.
So that's basically what a green prescription is. So anybody is eligible for a green prescription, so that is over the age of 18, that's medical conditions are stable, that is really inactive at the moment and needs support to become more physically active.
Where can the viewers get a green prescription from?
The viewers can get a green prescription from their doctor, their GP or their practice nurse, and also some specialists like psychiatrists and diabetic nurses, and other people can refer also. So basically it's really just talking to their GP or their practice nurse about how they can go about getting a green prescription.
Can you briefly explain what happens when you register at a green prescription service, Kerry?
Sure. So once we receive that green prescription, it comes through to us, and that happens nationally, so throughout all of New Zealand the green prescription will either come to a regional sports trust like ourselves, Sport Auckland, or to a PHO or primary healthcare organisation that may have a contract for green prescription. So then the patient support person within that area will make contact with the patient, so they'll get a phone call, and then what will happen is that they will be registered with the service. So there's a few questions, for instance, what if you've got any medical conditions, what they are, what you'd like to achieve from being on the green prescription program, what sort of activities you'd like to do, and really where you'd like to start. So, and also sometimes what the barriers may be that might stop you from actually starting in physical activity, because that's a big one. For instance, things like cost, transport, various things. So it's really talking to the patient support person about what sort of physical activity you would like to do, because there's no point in saying, the patient support person saying, oh, it'd be great if you went and did aqua aerobics, when that person absolutely hates the water. So it's finding out what they would like to do, because it's all about having fun and you sort of forget you're actually doing physical activity. So, and the patient support person will sort of put together an activity planning sheet with them, so whether the support's actually over the phone, because throughout New Zealand it's a phone support service. Within some regions, for instance in Auckland City and Counties Manukau, we have community programs, which is a face-to-face program where people can come and meet the patient support person and sit down and do all the registration side of things with them in front of them, and sort of get the support that way, and also making friends. And that peer support is very, very, very important, and not to be underrated.
Why do you think green prescription works?
I've been with green prescription since 2006, and I very much believe in the service. The success stories that we hear are incredible. It doesn't necessarily work for everybody. It's not necessarily suitable for everybody, but for those people that stick with it, and the health benefits, for instance, I actually was talking to a lady in Mount Albert a couple of months ago at one of the pools, and she lived 10 minutes away from the pools, and her goal when she first started was actually to be able to walk to the pools. And she said, Kerry, I could barely walk, and she said my mobility was absolutely terrible, and she said now I can walk to the pools, do my aqua aerobics, and I can walk home. And she said, and I feel great.
Good.
And hearing those sort of stories, and people that have gone from have type 2 diabetes, they've come off their medication. Other people have had very high blood pressure, it's now under control. All sorts of amazing stories, and it would take me all day to share the stories with you, but we have definitely seen an increase in people becoming what we call independently active, so those people that are doing activity most days of the week, so that's that 30 minutes of moderate intensity, so that huff and puff activity. Yeah, so it's definitely increasing.
And I totally agree with you, Kerry. Being an ex-coordinator at Mount Talbot, running the Mount Talbot program, I definitely saw the benefits of green prescription, and the friendliness and the friends they made. It just went well.
Right. And also I think for a lot of people are actually graduating off the service, so those people that have sort of experienced the program for themselves, they've been on that journey, they're the ones that come back and can support the new people. So it's having those role models within the program that are very, very key, because they're the ones that can support people and, you know, within the community and also within their own groups. So.
Kerry, are there many South Asians, Indians, participating in green prescription programs?
Absolutely, and also it depends on the demographics of the particular areas, but I know, speaking from, I guess, from Sport Auckland hat, within Auckland City and Counties Manukau last year, we saw around 700 South Asian, Indian people, descents coming along to the green prescription program. So within Mount Roskill itself, we've seen, actually it's our biggest South Asian participants. We've got 45% of our community program participants are of South Asian descent, so it's fantastic.
Where can people get more information on green prescription, Kerry?
There's two ways they can go about it, Ella. They can either call the 0800 active number, so that's 0800 22 8483, or they can talk to their doctor or their practice nurse about a green prescription and go about it that way.
Thank you very much, Kerry, for coming along to our show and talking about green prescription. I'm sure our viewers will get a little bit more information and hopefully come along to green prescription.
Thank you, Ella. Thank you for having me. Great.
Well, that's all from ChaHealth today. I hope you've enjoyed the session learning about green prescription. Don't forget, increase that little bit of salad, little bit of fruit salad into your diets and enjoy a healthy meal. Well, I'm going to go for my run today. 30 minutes a day, that's all we're looking for. Come along with me and go for a run. 30 minutes.